Lisinopril is known for taking the lives of people of color, and it is often prescribed by your physicians for management of high blood pressure, also known as hypertension. Let's talk about if you should take lisinopril and what your options are. First off, I should say that abruptly stopping lisinopril because you saw a post on Facebook is not a good idea, because typically that leads to a heart attack or stroke. And being that I've taken care of very many young stroke patients, I'm talking about early 30s, 35, 38, completely bedbound, unable to care for themselves, unable to move. I encourage you to explore your options, and you do have options, and that's what we're going to talk about. So first off, why is lisinopril the reputation for killing people of color? Well, because lisinopril falls into the drug class of ACE inhibitors. All blood pressure medications have a method of action or a mechanism of action, meaning they affect different parts of your heart, different cells. The reason why there's so many different drug classes is because they all are used for different things. If you have heart failure, your doctor might not put you on the same things that he would put someone who has high blood pressure alone. Or if you have high blood pressure combined with diabetes, combined with kidney failure, then your doctor is going to put you on a drug that will help your blood pressure while also protecting your kidneys and helping with your diabetes. However, if you have certain intolerances, or let's say you have high potassium levels, then he's going to put you on a medication that works best with your body, your biology, and what you have going on. So ACE inhibitors are usually the first line treatment in hypertension, right? And hypertension a lot of times has to do with, yes, your kidneys, but also salt retention and also stress. So there's many different reasons for high blood pressure. The medication that you are put on is not intended to be a permanent, lifelong thing. What it is meant to do is to lower your blood pressure while you make the lifestyle changes. So take 6 months to a year to quit that stressful job, change your diet, lose the weight, decrease your sugar consumption, and once your blood pressure is under control, your doctor will take you off the medication. However, a lot of people would rather just take the medication so that they can continue eating how they want to eat, but that's not what the medication is intended for. So the reason why lisinopril is known for killing people of color is because it has a side effect of a dry cough and angioedema. Angioedema is when you experience... I want to clarify that all medications come with side effects. Determining which medication is best for you has to do with your compliance, your biology, your needs, and your pre-existing conditions. Black people are not the only ones that suffer from angioedema. The first patient I lost to this actually was not black. It was a white man. Swelling in your mouth, lips, and throat. When your throat swells, it can close. Your airway is gone, and that can kill you. However, that side effect is in less than 2% of the population, less than 2% of clinical trials. Usually the side effect, if you have it, will simply be a dry cough. And the instructions the doctor tells you when he puts you on that medication is that if you develop a dry cough, come in to see me ASAP. Because what they'll do is switch your medication dose and put you on a different medication if you develop that dry cough. If you don't develop the dry cough, you should be fine. But usually the first sign is dry cough. And if you ignore that, eventually it could be angioedema. Now, with that being said, why are we prescribing lisinopril in the first place? What I'm about to say next is my opinion. Take this at face value. But the preferred drug for hypertension, based on what I've read, is Entresto. That drug, out of pocket, costs $867 per month. I think it's up to $900 per month. Lisinopril, out of pocket, is between $50 and $100 per month. Both are covered by your insurance. However, based on my experience and what we know about healthcare, is that although your doctor can recommend it, he can prescribe it, he can order it, but it is up to the insurance companies if they approve it. Both of them are covered by insurance, but based on my experience working in the clinic, even if a doctor prescribes a medication, we still have to get a prior authorization. We still have to go to the insurance company and justify why we're prescribing this and that the patient needs it. And the insurance can cover it and they cannot. The insurance, for example, if you break your leg, the doctor can go and say to the insurance company, this patient needs surgery. I need to operate on his leg or he will not be able to walk. We all know that the leg needs operation. We cannot use herbal medicine for this leg. We cannot use physical therapy for this leg. He needs surgery. But the insurance company can say to the doctor, we want the patient to try 6 months of physical therapy first, and then we want to try this medication first, this treatment first, and then we will consider approving the surgery to be paid for. Now, at this point, even though we all know that the patient needs surgery, we have to do it. 6 months of physical therapy. And then after 6 months, the physician can go to the insurance company and say, hey, we did 6 months of physical therapy. The patient went to all their visits and the leg is still broken. Now will you pay for the surgery? And then the insurance may or may not say, sure, we'll pay for the surgery. So considering the price discrepancy between Lisinopril and Entresto, I would imagine the insurance companies favor Lisinopril. I'm not saying it's right. I'm just telling you how healthcare works. So what could happen is your doctor can put you on Lisinopril and we can try that. And if you develop a dry cough, you can go back and your doctor can go to the insurance company and say, hey, my patient tried Lisinopril. It was ineffective for the blood pressure and they developed a side effect. Can we get approved for something else? Can we try a different drug class, or can we try Entresto? Can we try ARB? Can we try a new generation drug? What can we try? So that's kind of how that goes. A lot of times you have to go through the treatment and then fail it in order to get approved for the treatment that you actually needed. Again, I'm not saying it's right. I'm just telling you how it goes. With that being said, you don't have to stop taking your Lisinopril if you're not having any side effects. But if you're uncomfortable with it, it'd be a better option for you to go back to your doctor and tell them to put you on something else instead of abruptly stopping. Because if you stop it abruptly, again, a good chance you'll have a heart attack or a stroke. This is not really something we want to play with, right? Anyway, if you have any questions, please drop them in the comment section, and I hope this helps.